Okay, welcome everyone. My name is, excuse me, my name is James Orbinski. I'm the director of the Dahdaleh Institute for Global Health Research here at York University. I'm delighted that Tarra Penney, Professor Tarra Penney, will be doing a presentation today on systems thinking and evidence-based global health policy. But before I introduce Tarra, I just would like us to acknowledge the land that we're on. And as this is a hybrid event, some people are on different physical territory, but acknowledging the land that you are on, or that we are on. This is hybrid. This is a very important way to begin our meeting. So for those who are online, please also just take a moment to give thanks for where you are, and most especially the land that you're currently living and working on. And so today here physically, we are on York University campus in Toronto, and York University is situated on the traditional territorial area known as Takaranto. And we acknowledge that its current treaty holders are the Mississaugas of the Credit First Nation, excuse me. We also acknowledge that this is the traditional territory of many Indigenous nations, which include the Anishinaabe Nation, the Haudenosaunee Confederacy, the Huron-Wendat, and the Métis. And the territory that we are on is subject to the Dish with One Spoon Wampum Belt Covenant. And this is an agreement to peaceably share and actually care for the Great Lakes region that we are living on. And so with that acknowledgement, it's really my pleasure to introduce Tarra Penney. And Tarra is a population health scientist who's focused on the prevention of disease at the global level. And she's an associate professor of global food systems and policy research, an investigator also with the Global Strategy Lab, and a faculty fellow, I should say, of the Dahdaleh Institute for Global Health Research here at York. Tarra completed her PhD and also her postdoc training in epidemiology and preventive medicine at the University of Cambridge. And she really focuses on collaborative, multidisciplinary systems-focused research. She really, through that research, hi, welcome. Can someone get an extra chair? Oh, here you go. We have a spot here for you.
Oh, you do?
Yeah. Maybe just scooch down about 6 inches. I'll get the.
Thank you.
How are you?
I'm good.
Welcome. Sorry. Tarra, you can sit there.
Are you sure?
Oh, absolutely. Yeah.
Just in case someone comes, I can. We've got more chairs coming in. Oh, right. No worries.
So Tarra really focuses on supporting evidence-informed global health policy that is fit to tackle some of the greatest global health challenges that we face today. She has worked with many different organizations around the world and currently works with many different organizations. And what Tarra tries to do is apply systems thinking, and I should say not just try, she does it very successfully. Apply systems thinking and multiple methods to generate observational and evaluative evidence that help us better understand the context and impact of globalization processes on food systems and on human and planetary health. So I will let Tarra give more detail. I don't want to baffle you with all kinds of jargon that's not explained, but I'm sure Tarra is going to give us an overview. But before she does that, I just want to say that she works now with the WHO European NCD Prevention Office, the Cambridge Global Food Security Unit, which is an interdisciplinary research center at the University of Cambridge, and also the Global Food Security Program in London. And she's contributed to program evaluation and review panels for the IDRC, for the United Nations Development Program, and many others to support assessment of research quality and program impact. So it just gives you I hope that gives you a nice background to Tarra. And I will say that Tarra has, I would say, fairly recently, I think still say that, fairly recently joined faculty here at York. And she's just made already an enormous contribution to the School of Global Health, to teaching here at the university. But from the perspective of the Dahdaleh Institute, and which is focused on research, Tarra really is one of the handful of truly leading scholars internationally that are thinking and practicing very carefully and meticulously a systems-based approach to global health challenges. And you'll see, I hope.
You're going to get yourself in trouble, James.
I know. A systems view really requires an openness of mind. And it also requires a systematic application of a systematic and rigorous application of methodology within that openness, so that you are trying to create an understanding of a complex web of causality that has multiple subsystems within it and that are driven by multiple forces and factors. And that can shift and change according to where you are in time, according to whatever policy issue you're taking on, and so on. So it's a very, very complex theoretical and practical challenge. And that we have a person, and not just that person, but one of the leading people in the world here thinking about this and helping us learn this. This is the goal. So welcome. And with that, I hope the presentation goes well.
No pressure. Yeah.
No pressure. So.
Well, thank you, James, for that really kind introduction and very accurate reflection of what you'll soon see in the slide. Perfect. So well done. And thanks to the Dahdaleh Institute in general for inviting me and letting me contribute to this really exciting seminar series. Just as someone who came in fairly recently, is definitely a fair characterization. To see you all sitting around the table here for those who are in person and everyone online is just an absolute thrill. So thanks to the Dahdaleh Institute for leading on this kind of work and bringing us all together and giving us space to have these kinds of conversations. It's really exciting. So I am thrilled to be able to talk to you about systems thinking and how I'm applying it in some of my work. And before I do that, I just want to provide a very brief overview of how I'll kind of characterize the next. I'll probably talk for about 20, 25 minutes if I can, leave the rest for discussion. If you have a burning question for folks in the room or online, you really want to ask it, I don't mind to stop and answer a question, not a problem. But hopefully we'll have time afterwards as well to chat. But I'd like to give you a little sense of, as James mentioned, I started out in epidemiology. So how in the world did I end up somewhere like systems thinking and systems approaches? So I just want to tell you a little bit about that. And then for folks who aren't familiar with systems approaches, provide a little bit of an introduction, how we've been thinking about it and some of the work we've been doing, and introduce you to a little bit of that. And then round it out with something that's just really important and that I value quite a lot, which is, and I think we care about in global and public and population health, is to try to position our research for use, for usefulness and for impact, and to actually help improve the lives of people. That's why we don't normally do it just for fun, although it can be. We tend to do it because we would really like our evidence to be used in decision making. So just to start out a little bit, if I go before myself as an academic, I'm from Canada, the east coast of Canada, small island, Cape Breton. I don't know if anybody has sort of heard of it, but it's a very small community, rural community, which is absolutely beautiful. We have the Cabot Trail. It's gorgeous. If you haven't been there, please go around the Cabot Trail in the fall. It's amazing. So that's my Cape Breton plug to you all for tourist purposes. And when it came time for university, I went off to the big city, our big city, 500,000 people. And I went to Dalhousie University. I did my undergraduate degree in psychology, experimental psychology and computer science. So my multidisciplinarity kind of runs sort of deeply. And I stayed there to do a master's degree in health promotion. And then shortly after that, I went across the pond. I went to Cambridge, where I did my PhD in epidemiology and preventative medicine, stayed on for a postdoctoral fellowship there, focused on policy evaluation. And I was part of the Medical Research Council, their kind of epidemiology unit as well. And then I arrived in 2019, so not that long ago, a little tiny bit before the pandemic, showed up here at York for the School of Global Health, a really exciting time where we were forming the school and the institute was getting started and all of those kind of fun things were happening. So that's just a quick sort of overview as to how I got here. And then to give you more of a view of how I got from epidemiology to systems thinking. So I wanted to share with you, when James did my introduction, he mentioned I think of myself as a population health scientist, and that's quite specific. And I just want to unpack what that means because I think it informs the rest of the stuff that I want to talk to you about. And that is that I sort of think of populations as distributions, right? Epidemiologists tend to. We think of the distribution in terms of the level of risk that you might have in that population, risk of diabetes, risk of cardiovascular disease. And there's a certain approach to prevention that thinks about identifying those who are at the highest risk of disease, developing policies, interventions to target them to make sure people don't go from a high risk of disease to actually contracting or developing disease, right? So that's one approach to prevention. There's another approach to prevention, which is more in line with how I operate, and most of my research is been characterized. So you have that same level of risk in a population, but the aim and the point is really actually to shift that entire distribution of risk. So I'm really interested in those kinds of preventative measures, policies, structural changes that shift distributions of risk in entire populations. Okay, so big things. So population approach. And of course, one of the main texts that sort of shaped my thinking on this was Jeffrey Rose, who published a text on preventative medicine, where he talked about the difference between a high-risk approach and a population approach to prevention. And there are just two really key things that he articulated in that book that I wanted to share. So it really shapes the rest of my research program and the way I think about it. The first one is this recognition that decisions that most affect health do not happen in departments of health. Okay, they happen outside of health. They happen in environment, employment, education, social security, the treasury, so how the government decides to spend its money. So that recognition is really important. It also means we have to work together to solve these kinds of problems. And then on top of that, the population strategy prevention is really, really obsessed with the causes of the causes. So not just identifying symptoms, but getting at underlying causes for illness, disease, and poor health. Okay, so this idea of causes of the causes is really part of a big contributing factor as to why I'm interested in systems approaches. So sort of the lesson I took from all of this is that, you know, if you want to do something about population health, you want to shift distributions of disease, you're thinking about automatically complexity, multidisciplinary, multi-sectoral type evidence and work, and trying to inform policies that shape those structural factors. And the question really becomes, how the heck do we do this? How do we actually do this kind of work? So when I was doing my PhD, I was in an epidemiology unit. So of course I was thinking and working like an epidemiologist. And when I showed up there, I was still really keen to make sure that my research was policy relevant. So the first thing I did when I got there was I looked around and I thought, well, this is the UK. I'm not familiar with this country. I sort of came up in Canada. What does the government think about right now? What's on the docket in terms of important things? And the thing they were looking at the time, this was sort of 2012, 2013, was the childhood obesity prevention strategy was something that they were formulating. And they were particularly worried about something they were calling it as food swamps. So the over accessibility and availability of cheap, unhealthy foods in communities. This was something they really cared about. So because I was an epidemiologist, I wanted to understand patterns of disease and their determinants. So I did a series of studies to try to look at the association between these food swamps. How do we characterize them? What do they look like? And their impact on diet and health in the population. And I did a couple of papers on that, and lo and behold, you could say, yeah, it's a factor, it's a contributor. But of course, because I'm not just interested in understanding the problem, I wanted to try to solve it. My next sort of question was, okay, so now that we know that this is a factor, how do we actually change it? So we went out to the literature. The UK hadn't done a lot of this yet, but there was a ton of evidence in the US and Australia, and there was a study or two actually in Canada that looked at how do you change the local food environment to improve diet and health. So we thought we can learn lessons from that. Let's go out and find out what's effective, what's working. And thinking I was being kind of smart about it, I thought, I'm not just going to look at what's effective. I want to know why it's effective and who it's effective for and what the context is. So I took this realist approach. A lot of that is theory development, trying to understand why an intervention or policy has a particular impact. And we mapped out the way we thought these interventions worked and how they could work to succeed. And when we compare, first of all, when we saw the theory, we were a little bit terrified. We thought, what are we going to do with this? So there was a first realization that, oh, this isn't just complicated. This is complex. It changes over time and over space. And there's a lot going on here. The second thing we noticed were when we were looking at the interventions, the vast majority of them failed. So there were very few examples in the literature trying to intervene in something this complex that were actually effective. So we thought, why is all of this failing? So I took a step back and thought, as an epidemiologist, do I really have a toolbox that is equipped to deal with this level of complexity? Do I really know how to change systems? That's not really sort of what I've been focusing on. And so as a result of that, I got really interested in methodologically, how can we identify systems approaches and methods that answer questions and help us understand systems, not just circumstances or factors, but how they're related and the drivers that cause them, those sort of foundational drivers that cause them. So to do that, I just wanted to first introduce you to folks, because I'll say words like systems thinking or complexity science. So I just want to give you a little bit of background about what I sort of mean. So you might hear systems thinking, you might hear systems science, you might hear complexity science. There's different definitions, different conceptualizations, and they're different, and there's a lot of variety because there's a lot of different disciplinary legacies within an umbrella area like systems thinking. And it really depends on the school of thought that you might have followed. So engineering might have their own way of looking at it. Data sciences might have their own way of looking at it. Management have their own way of looking at it. And the way that I felt aligned really nicely with the concerns around from population and global health perspective were those of sort of Donella Meadows. So I follow more her school of thought of systems thinking, and I just wanted to share her text there. It's great. And also, I like that she can be brief and to the point. And so in the simplest terms, she describes a system as an interconnected set of elements that's coherently organized in a way that achieves something, which I just thought that is a nice just distillation about what a system is. And then I also really liked the way she talked about changing systems and how describing systems is one thing, changing them is another. And the way she described how we change a system really resonated with me based on how I experienced the whole food environment circumstances. So just to read it to you, we can't impose our will on a system. We can listen to what the system tells us and discover how its properties and our values work together to bring forth something much better than could be produced by our will alone. So just this idea that if we just go in thinking we understand what's happening here, implement a bunch of interventions that are very sort of linearly defined, and we don't have a lot of success, we might be fighting against the very system we're trying to change. So I really liked that. And then I just wanted to share with you as well, there's two other texts that are just really nice resources. If you're interested in systems thinking, one is systems concepts in action, and then the other is that community-based system dynamics. So it goes into more depth in different areas of systems. And then the other thing to share with you, if I just loop us back for a quick second to the mentioning the causes of the causes, this is another reason why systems thinking sort of spoke to me, and I was interested in the methods behind them. So there's another way to think about systems thinking is this sort of iceberg metaphor, which is to try to help us probe the underlying causes of events and identify patterns of complexity, okay? So you can think of everything above the waterline might just be events, the things that we see are happening. They tend to be the things we want to change, right? We observe them, we want to change them. And then under the waterline are all of the causal factors that are driving that thing, that event or so that occurrence that happened. And so at the first sort of level of depth, you might have patterns of behavior. So you might detect trends over time or things that are changing or being modified over time. If you go a little deeper, you'll get at things more like a system structure. So what are the parts of that system? How are they related? What are the influences and patterns that might emerge from that? And if you go a little lower still, you get into this idea of mental models. So what are our values and assumptions and the beliefs that actually shape the structure of our systems? Okay. And then the question still remains, even though this is a really excellent metaphor, coming back to research and more as a scientist, right? I'm interested in how do we investigate these different layers empirically in the population and in global health research to actually inform policy? How do we make that transition? And that led to this massive piece of work that was led by Chloe Clifford Astroby, and she did an amazing job with this. We partnered with the WHO, our sort of regional partner there. They were also interested in systems methods, how they can be used in global health and population health. We started with a scoping review to identify as many instances of different systems methods being used in this domain. We packaged them all together, translated into some guidance, some training guidance that we use to actually help people navigate decisions. Is my problem a systems problem? What kind of method should I use, et cetera? And we use that not just hopefully published here, but yearly we have a summer school with the WHO where we deliver this training. We usually have about 2,000 applications. 30 folks can attend normally. So there's a lot of interest in systems, methods, and approaches. It feels like people identify and with having that need of trying to understand things in a bit more of a holistic way. And then just to give you a very brief overview, there's a range of methods. So if you're talking about systems thinking, you're actually talking about a suite of methods. Okay, it really depends on your question, what kind of a method you might choose. So I just want to highlight a couple that came out of the review that are part of the guidance. Concept mapping can be a systems method. It's just about visualizing interconnections within a system. Network analysis can be a method, and I'll talk a bit more about this on another slide. Agent-based modeling is a systems method. It's more of a quantitative modeling approach to look at different scenarios and understand how actors might influence one another and the wider system. Causal loop diagrams are a great tool as well for understanding systems that I'll talk about in a second. And then group model building is more of a participatory approach where you can generate and develop these causal loop diagrams, but from a multi-stakeholder perspective. And then systems dynamics modeling, again, more of a quantitative modeling approach. And you can develop systems dynamics models based on something like a causal loop diagram that was developed using an engagement approach like group model building. So just to give you a bit of a quick, terrifyingly fast overview of multiple methods. So how have we applied some of these? So briefly, I just want to introduce you to two examples. And before I do that, or to give you some context for that, this is just a particular project that we've been working on now that's more in its wrap-up stages. So being obsessed with prevention, as soon as the pandemic hit, many of us were actually interested in how we prevent the next pandemic. And so we wanted to think about from sort of a One Health perspective, what are the sort of governance and policy challenges that we're facing to help prevent this from happening again? So just to give you a little insight into pandemic prevention, one of the ways that COVID-19 happened was a spillover event. So you have sort of an animal to human transmission of an infectious disease. That infectious disease, there's no immunity in the population for that, and it spreads very quickly throughout the population. So if you think of the causes of the causes, you want to prevent the next pandemic, you're thinking, I want to prevent animal to human transmission of infectious disease, right? So that's what the sort of focus of the project was. We knew from the outset this was going to be a big multidisciplinary piece of work. So Mary Viktorovich, who's part of the Dahdaleh Institute as well, the associate director, and I applied for some funding along with a bunch of other colleagues, James included, from York University and the School of Global Health and other faculties within the within York University that covered a range of disciplines. So social scientists, public health folks, and infectious disease specialists from Ottawa and Montreal, some organizational support, WHO, the FAO, and we again implemented a range of different methods, institutional analysis, legal analysis, along with the systems analysis. And we were focused on different countries, right? So the DRC, the Philippines, and China. So areas that either had very impactful spillover events or at a very high risk for spillover events. This was part of the rapid response call. On the right here is just a quick summary. We're at the point where we're starting to summarize the multiple pieces of evidence. So that would be an example of sort of an evidence brief that would be a part of the output of the study. But what I want to share with you is two quick examples of using systems approaches in this project. So the first kind of question you can answer with a systems approach, given that kind of a project, is what is the structure of that transnational network that might govern wildlife trade across the globe? Who's responsible for that, and what is happening amongst those organizations between themselves? Okay, so if you actually want the system you want to understand, then would be transnational organizations that play a role in wildlife trade or governance. Okay, so your systems question might be something like, what is the current structure of this transnational network, and how might they support or undermine progress in that domain? Okay, so you're trying to map the structure of that network as much as you can. And in our example, we actually did a mixed methods network analysis. So we also did interviews to not just understand the structure, but how it works. And therefore, you might select a systems method. So you might take network analysis, which in our case, we used a survey and follow-up interviews with key informants to do this kind of an analysis. And you can look at the extent to which organizations might be connected with one another, or there might be silos, there might be power dynamics at play. These are all things that you can examine using a systems method like network analysis, especially if you pair it with some qualitative methods as well. Okay? So again, I won't go through the results, the paper for sure, if you're interested, feel free to read, but as an example of a systems method and how you can drill down to a specific question. So another quick example would be a kind of question that you could answer would be, what are the unintended consequences of wildlife policy? And because we're interested in food, this could be related to the food system, but also how the food system interacts with prevention of spillover. Okay, so that emerging zoonosis problem. So the system that we wanted to understand in this instance was that spillover event and trying to reduce that human-wildlife interaction across 3 countries. Again, we were interested in China context, the DRC, and the Philippines. So that means our systems question was something more like, how might unrecognized complexity in this system and system adaptation in response to that contribute to policy failure, if that's what we found were some policy failures. And the systems method that can be used with that, as I introduced before, is something called causal loop diagram. So you try to map out a system, looking at different factors, how they're causally related to one another, and then going a step further than that, you can try to identify patterns within that causal loop diagram. And that's something that we can call an archetype. So just a mini pattern that might not be specific to just our map. It's a very common systems behavior that once you identify that that pattern exists, you might know what to do about it. Okay, so that's why we're interested in archetypes. So we started with a causal loop diagram. We moved from that into identifying different types of archetypes. In our work for this analysis, we were interested in an archetype called fixes that fail. So we were looking for policies that were implemented that in the short term seemed to do something good, but with a very minor systems adaptation over time ended up undermining the original ambition and intent of the policy. So we tried to identify those when we could find them and reported on them in the paper. Okay, and then just to loop back then to positioning research for use and how all this is sort of connected to that aim, if you like, in sort of global population kind of public health. So one way to think about positioning for, has anybody heard that phrase, by the way, positioning for use? It could be a very common phrase in some development work or development research, types of research that are where it's really important that you don't just generate evidence, but you make sure you do everything you can as being the generator of that evidence to position it to be useful and relevant and accessible to folks that need it. So that's the one way to think about it, is the degree to which research is likely to be taken up and used to contribute to outcomes and impacts. So for the kind of work that I do, there's no guarantee I'll generate evidence and someone will use it, right? That's a governance challenge. That's a democratic challenge. That's, out of my hands to some degree, but there are things that I might do to make sure that I at least position it for use whenever I can. And just to share a couple of those with you from my perspective, at least one is that the evidence is credible. So through partnership, in particular, I just want to emphasize a lot of this happens through partnership from my perspective, but One of them being that through partnership, you're able to develop more and better credible research. And what I mean by credible is, robust method, a method appropriate to the question, and that there's some element of peer review, or you're able to publish that research in one way to give it some credibility, can help you position your research. That there's a sense of legitimacy to the research, so meaning that it represents the actual needs of a community or a country or a stakeholder group, someone that you can work with to make sure that it's I use relevant, so I won't use relevant, but legitimate from their perspective. This is the question that should be asked and answers. Yeah, great. And that it's actually relevant. So you've had some consideration of maybe the timing of it, or that there's an ongoing policy process or some sort of decision-making that's happening, whether that's community level decision-making or government level decision-making is irrelevant. It's just that there's some sort of decision-making happening that you want to be part of feeding into. And then again, through partnership, that means it can help you stay informed of these things. So as a researcher, I, use my day in various ways. It's not usually to check in with where policies are at any given moment, but through partners, I can be well informed of when things are happening that matter that I can feed into. And again, through partnership, really important to make sure, related to sort of having legitimate, relevant research, making sure that our research is equitable and not undermining the very sort of global health inequities that we're very often trying to solve. So that means thinking about our research practice very carefully, who we're involving in when and how, and making sure that when folks contribute to our research, that they benefit from that contribution. In our instance, very often global health, trying to make sure they might even benefit more than we might benefit here. So sort of research for development in a sense. Okay. And then this is just an example I wanted to share with you for the sort of study where I was highlighting some of the systems analysis. It was a big team. It was a big group of folks involved in that work. There were multi-country teams involved in data collection and shaping the research, using their data owners in that research, so they own that local country level data. They can use it in a way that supports their work nationally and locally as they need it. They were kind enough to let us use some of that for our own sort of systems analysis. And then, of course, the amazing colleagues we have here at the Dahdaleh Institute, at the School of Global Health, at York, who support the work. Within my team and beyond, within our faculty and beyond, and some of our colleagues as well at other institutions. So just to give you a sense of when I sort of say partnership, what do I mean? I mean building a project that can engage folks over time and make sure that there's opportunities for people to get involved as much as possible, which is actually really, really difficult, right? Anybody that's run research projects knows how actually difficult that is in practice, really hard. So just the other thing I wanted to highlight, again, this would be sort of the summary, the evidence summary that's coming out of that project. And I just wanted to point out where that multidisciplinarity shows up. So we had a question, around global governance. So there were folks on the team publishing papers that focus more on social science, on network analysis, looking at it from a different perspective, producing papers that look at it from that perspective. Carrie Wu is a colleague as well, a social scientist who published some of the research that was focused more on the China context, for example. So again, making sure the project can support people in their own disciplinary perspective and still trying to make it coherent and fit together. More of the questions that were related to policy and what we can learn that's informing policy. Some of the disciplines were public health, so evidence synthesis. There was systems science, legal analysis. So again, folks publishing different pieces of evidence all coherently related to lessons that we're learning that might help to inform policy, but doing it sort of in a multidisciplinary way. And then again, so some folks towards the end of the project where now you're trying to think about what are we going to do with these results? How are we going to translate them? How are we going to engage in conversation and inform policy in a more tangible way? What does that look like? And so folks that have more of a background around design thinking or developing solutions or knowledge exchange can help with this kind of part of a project where you're coming up more with maybe policy briefs and maybe holding or forming workshops and doing things around solutions. And then the last thing I wanted to share with you from this point of view is, just one small example that was related more to the systems analysis that I shared. And this is, so in this project, it was multidisciplinary. It represents multidisciplinary research. There were published peer-reviewed papers. There were policy briefs, opportunities to share at webinars, give presentations. So lots of people on the team were doing lots of those kinds of dissemination activities. But we were also acutely aware that there was a big global policy event happening around the time of this project, and that was the pandemic treaty. So we were well aware of the pandemic treaty, and that was under consideration. Well, we thought it was going to be solved, but it was under consideration at last year's World Health Assembly, and this year, it would have been last year, where, of course, at the same time, there are normally side events that happen at the World Health Assembly, and you might get invited to present or talk. It's the opportunity for policymakers and researchers and civil society to get together and talk about and inform the treaty. The Geneva Health Forum is one example of this, and they have their own side events. So we were invited to present the systems analysis to a panel. And it was really interesting. What they were really interested in was almost more the value behind the system analysis than its acute findings, right? Because pandemic treaty and global policy is a very high level. So there were some really key things they were interested in. A was, how do you avoid policy failure? So that was of acute interest to folks developing that kind of a treaty. And the other was trying to make sure that there is country level evidence getting fed into that process. So the fact that we did a systems analysis and that systems analysis covered multiple countries and compared them in some way was also a reason, I think, why it got the invitation would have come through. They wanted country level inputted evidence. Okay? So just, kind of preparing for opportunities, and how sort of wanted to make the point on this slide that when you're choosing your methodology and your approach, you're sometimes choosing whether you're set and positioning yourself for use or not as well. So I think some of the systems approaches and analysis were pretty good to help us position research a little bit better. Okay. And that is everything for me. These are my acknowledgements, which is pretty much the slide you saw previously, but folks that work on these projects and help guide me and support the research that I do. And, just an absolute heartfelt thank you to everybody that I work with and have ever worked with, and students that I have interacted with. Everybody's contributed to the work in a really exciting way. So I hope that's pretty clear, and very happy to open it up for questions and discussion. Yeah, thank you very much.
That's great. So just a couple of people do people have questions immediately? Yeah, one, perfect, excellent. Okay, three. Okay, just a couple of quick comments. Often people are kind of baffled and intimidated by the name of something: complexity theory, system dynamics thinking, so on. And what Tarra has done, that's one of the best presentations I've ever seen. Seriously, you've identified the core concepts, the absolute core concepts, and you've described them, you've explained them in a systematic and coherent manner that tells us a story. It tells us a story of how we can think differently about major complex problems that have many different dimensions. And I love the iceberg metaphor. It's very, very powerful. And the last thing I'll just say is that you've given us a meticulous perspective that is very operational, that starts at the operational level. What's the question? Right? What risk am I trying to mitigate, identify, influence, reshape, whatever? And then you go up the iceberg to the event. Now, as you go down the iceberg, it gets fuzzier and fuzzier, right? In terms of, well, what are the issues? What are the drivers? Are there worldviews? Are there mental models that shape how we see a phenomenon? Now, for new researchers, which is the majority of graduate students in the room, it's very important that we recognize that our mental models actually, I don't want to say bias, but they are almost a bias. They shape our choices further up the iceberg. Right? And that doesn't mean that they're wrong choices. It does not mean they're the wrong choices. But what's extremely important is that we recognize that they are mental maps that are rooted in values, in morality, in metaphysics, in political theory, right? And again, none of that is bad. Well, some of it is bad. You know, like certain
it can have bad outcomes.
Well, that's they have bad outcomes.
Yeah.
And some, let's face it, some political theories or some political, perspectives are just, we just have to reject that outright. But what you've presented is a way of approaching that. And I couldn't have asked for a better presentation. That was fantastic. So thank you. Yeah, that was really, really good. And with a lot of practical examples. So let's go to some questions. Go ahead.
So my question is about how much mapping of the systems do you do before you find the question that it is that you want to answer? So I'm wondering, did you come up with the question first, or did you actually map out the system and take it back to see?
Great question. So I would say we always start with a question. So we would have an overarching question. There's something about a system we want to understand. And we make sure that the method that makes sense for that question would be something like a causal loop diagram. Oh, we have this question and a causal loop diagram is the way we answer it, for example. Like it's important for us to understand the causal drivers of the system rather than the network example. Oh, it's important for us to understand the structure of a network and how different institutions are connected. It would be really hard to get there using causal loop diagrams, right? So the idea is you have the question that then leads you to the specific tool or method that you want to actually use to unpack it. But then I think maybe what you're asking is there's a second order analysis that happens, which is maybe we want to use an archetype. So, once we have our systems map, what is an appropriate archetype that we could use to interpret this map? Then what do we do? So when that happens, that we don't have a priori. So when we go into a map, we do go in trying to understand causal drivers. Then we let the causal drivers tell us what's happening in here. So there's a little bit of art to that part. It's more of a qualitative interpretation and analysis where you know of certain kinds of archetypes and you try to detect certain kinds of behavior within that system that are mapped out that might match an archetype. And then you might question, how could we better understand this? So in the map that we have, one of the analyses we did was the fixes that fail, which is an archetype. But we could have looked for other archetypes. It just, those seemed like quite powerful. And going back to my positioning for use, relevant, useful pieces of information to know about that map right now. You're thinking about a pandemic treaty. Wouldn't you like to know the kinds of policies that are being implemented globally that are undermining our current efforts at preventing pandemics? So sort of, yes, once you get to that point, you decide what does your analysis look like? The similarity would be you're a quantitative researcher, you're going to do a regression model. You're going to do a regression model. You don't know the exact covariates quite yet. There's certain kinds of assumptions you had to test to find out what are the nuances of the model that you're building, but eventually you'll get those answers. So those types of questions you can figure out as you go. Does that?
Yeah.
Can I just add to that?
Yeah, of course.
So my experience using complexity theory and largely causal loop diagrams and agent-based modeling, and then derivative system dynamics modeling. My experience is that you sort of take a picture, like it's if I just use a metaphor. So you're trying to understand, like, what is this reality? What's my question? And what are the health impacts of climate change in Malawi, in the Chilwa Basin, for example? Right? You take a picture, and so you're not actually taking, you're actually drawing a picture. You're creating a picture. Right? But there it is, fixed in time. This is what I think it is. Then, as Tarra has said, the beauty here, it's not just a complicated description or picture. It's complexity, which is that it changes over time and space, right? So you've got a picture, you've got a description or a picture, and you've got a certain question that has led you to that. Then you say, then here's another time, the next iteration. oh, things have changed. Oh, how did that happen? What are the drivers? And then you could start to identify archetypes, right? Where are the power dynamics? What's this? And you can actually measure that. Like you can put a correlation value on this subsystem to that subsystem in this specific time and place for this particular question. Different question, different power relations, different archetypes, right? And that's the beauty of the theory, right? Is that you can evolve your understanding based on the validity in the first instance, the legitimacy and the validity of the map, and then of the legitimacy and validity of the valuation of each variable within the map. And so as the questions change, the archetypes change, the outcomes change, all of that. So that's the power of the, and you can also validate it. You can do a sort of a self-validation exercise over time to say, well, this is what it predicted. Well, was that true? Did that actually work? Right? What was the outcome? What were the unintended outcomes? So it's a self. I don't know if it's the right word, but you can validate it. You can achieve an internal validity that then presents itself as face validity, right? So then it's internal. If it's internally valid, then on the outside, you look at its face. Yeah, you think, yeah, that makes sense. Okay? So it's really, really, really a powerful tool. So go ahead. Go ahead.
I had a question specifically about group model building.
Yeah.
And I was wondering, sometimes, when we have a theory and we go to people, we find unexpected things in the system. And I was wondering, when you uncover things unexpectedly through that group model thinking exercise, how does that inform the process going forward?
So unexpected things, would you mean, so the only reason why I hesitate a tiny bit is, so through group model building, you sort of bring multiple perspectives together.
Mm-hmm.
You want to bring everybody around a table, and then you sort of use a bunch of scripts to help the group first do some systems thinking, like learn to become systems thinkers in a way. And then you have these scripts to follow, and there's a certain set of rules to get you to a causal loop diagram, like variables mean this. You actually use behavior over time graphs to generate the variables, because the whole thing is about system behavior over time. So when you build on it, you have all of these sort of rules in place that everybody's around the table, but it's not just a complete free-for-all. It's sort of in the development of this causal loop diagram, using the rules of causal loop diagramming. What is your perspective on why do you think these two things are causally related? How do you think these two things are causally related? What do you think is driving this kind of a trend that we're trying to interfere? And so to get to your question, I almost always am surprised by almost everything that comes back. People have really, I think when you're doing systems thinking work, you realize how important it is to have multiple perspectives around the table for this reason. I'm an epidemiologist. I work with a lot of different disciplines. I'm pretty versed in a lot of different disciplinary languages. I cannot anticipate what folks are going to come back with or what's going to be important things that I never would have thought of as being an important part of a system become really clearly an important part of the system very quickly. So in a sense, it's part of the group model building process is to invite surprises around the table and to try to create a coherent visualization of the system from everyone's perspective. So if that's what you, is that kind of answer? Yeah, like you will be like, oh, what the heck? And then it'll all become clear as you go. So you go in with a bit of faith, and then it'll all work out in the end. Okay. Yeah, great question. Great question.
Go ahead.
Yeah.
So
just introduce yourself. Sorry, I should have mentioned that.
No.
Traditionally, we used to kind of learn through the intersectoral coordination or multisectoral action plans.
Yes.
So how actually kind of we can think with the system thinking and the multisectoral participation and action plan?
Ooh, that's a great question. I think if it were, this might be my bias, but I feel like as an introductory, say you have something like you're going to develop an action plan. it might be helpful. And if you think that action plan wants to either change or inform a system, like the first thing you want to ask is the thing I want to do actually systems related? Sometimes we just think, oh, systems thinking sounds great. That's applicable for everything, but it's really not. So the first thing would be, are AMR action plans intended to do something that's important from a systems perspective? Is it trying to understand a system? Is it trying to change a system? Is it trying to embed itself within a system? And if the answer to that is yes, and it's important for everybody to see that they play a role in some sort of common system, then you could use methodologies like this to bring people around the table to develop or to see where they sit in the wider system of AMR action plan impact or something like that. And then if everybody contributes to seeing where they sit in that wider system, then maybe they're more apt. The idea, the theory would go, maybe then they're more likely to actually deliver on their part of the action plan, not just because it's a checkbox for them, but that they can see they're an important part of this overall system. But the first part I would emphasize is the most important part, where we don't just assume systems methods are good for everything. Like there might be a better way to get at that, and you want to explore that a bit. But that's a great question too.
And I just want to make one further comment. Sure. Embedded in the question is a really, really important foundational question about research. So we're all grad people here, grad students and professors, postdocs and all that. And in some way, we're focused on research in some way. So question is, what is research? This is really embedded in your question. What is research? And what's its purpose? Well, it's to understand a phenomenon, right? So that something might change, right? Either we might change our view that we have to change this. Well, no, actually, no, we've discovered this is actually beautiful and perfect. We don't have to do anything. We shouldn't. It's just wonderful. Or we might have discovered, well, here is a problem. And if we intervene here, then we can stop the problem. And so that's a good thing. So the point of research is to understand, which means in principle to step back. So you're to step back and see, observe, hypothesize, test. Observe, hypothesize, test.
Think.
That's sorry?
Think.
Yeah. Hypothesize, think.
Yeah.
Right? Like observe, think, hypothesize, test, right? So that's the core concept, like truly core concept of research, right? So, and that applies to critical theory, right? And it applies to clinical interventions in infectious disease management and everything in between, right? So it's to observe, think, hypothesize, test. Right? So a researcher, in principle, as that's their starting, is not is not in the first instance an advocate, right? A researcher in the first instance does those things. Now it can do those things with a view to engaging in advocacy, engaging in policy change, and you can do that. And Tarra has talked about how to do that, right? But it's very, very important that the first thing that a researcher does is observe, think, hypothesize, test. That's the value, right? So that shouldn't be confused with engaging in national action plans. It doesn't mean you shouldn't engage with national action plans, but the reason the minister of whatever wants a researcher involved in the process of establishing a national action plan is because the researcher, by definition, observes, thinks, hypothesizes, and tests, right? So that's very, very, very important. And I make the comment, Tarra, because in our discussions over the last, since we started in September, this has been a kind of a question. So like, what's going on here?
Yeah.
And so I've taken the opportunity to address it. So somebody else had
some questions in the chat as well.
Oh, yes, maybe you can look at those
Yes.
while we're just checking. Go ahead. Sorry, Tara, I'm
No,
going to
that's
draw your
okay.
attention back
Oh,
here.
Yeah.
Thank you so much for this presentation. My name is Chigozie Ogwu. I'm a postdoc researcher in the Department of Statistics, and I'm working on monkeypox, where I apply statistical models, spatial models, to understand factors influencing monkeypox. So this is actually very interesting, and I'm trying to involve it or connect it to what I do and where I could apply it. So I'm trying to understand it in the area of structural equation modeling or mapping.
Yep.
And is it like a kind of trying to understand interactions between factors that influence policy or influence a disease or that could inform policy? I'm just trying to connect it to what I know. And please, could you?
Absolutely. I had to start somewhere in my journey to systems thinking, and I decided to start at the epidemiology phase, but there was a phase before it. So in the phase before it, I was in health promotion, and I used structural equation modeling for my master's degree to look at influences of the food environment on diet and health, because I knew it was complicated.
Yeah.
But I wasn't yet in the frame where I thought it was complex. I just knew you have sort of simple modeling, right? A and B. You have complicated modeling, mediators, moderators, then you have complex modeling. So dynamic feedback and delays. So it just depends on the kind of modeling that you want to do. So if you're in the complicated modeling frame, which it sounds like where you're at with structural equation modeling, you don't really need a lot of this way of thinking. What these approaches would do is move your modeling from complicated modeling into complex modeling. So they would be different models of what you would use. You might use hybrid models or systems dynamics models. So it would just be, you would be in the realm of using different types of models. And in order to develop your modeling equation, the process that you would follow would be a bit different. So if you wanted to involve people in that process and get a really comprehensive view of what your model could look like, you could follow one of these processes, for example, and then come up with an actual sort of equation that would suit that. However, my experience so far is when you start with the qualitative, like, oh, let's ask the big complex question. And then you get to the point you actually have to model something. We're having talks with Michael about this right now, is that you're limited by data. You're limited very quickly by data. What can you actually model quantitatively? Because you're using structural equation modeling, I'm not sure what your variables and what kind of data you have it looks like, but that's primarily the big difference you would be looking at is changing what you're trying to model, the type of model you would be using, and complexity would come in that form, like you would use a new type of model. The challenge would be, is there data available for this new fancy model for you or not? Yeah. Does that help? Yeah.
So there's two questions on that I'll do. There's 4 comments or questions, but I'm just going to draw on 2.
Okay.
Could you talk about the potential relevance of medical anthropology to systems thinking and to complexity model? The potential relevance of medical anthropology.
I'm limited in part by my knowledge of medical anthropology, but anthropology is a field I know a little bit about because I just think it's a really important discipline, anthropology in general, observational research, community-driven observation. If I had to guess, I would say that my understanding of anthropology is it's excellent at considering complexity, that they have a toolbox that through observation and qualitative sort of inquiry are very good at thinking about and accounting for context and complex circumstances. I think where it would differ is just systems thinking, systems science, they have definitions and methodologies of their own that you use to get at systems and systems behavior. So for me, they might look different that way. So a lot of the rhetoric around systems thinking might be things around understanding complexity just as a notion, understanding context, et cetera. And I think anthropology would be great at that. Where they might differ is that if you were an anthropologist interested in understanding systems from a systems perspective, then you might want to employ some of the systems approaches or systems methods to a question that's relevant to you as an anthropologist. So does that make sense? So as an anthropologist, you might have a particular, sort of like me as an epidemiologist, my question, it turned out my question was actually a systems question. It just wasn't in line with my discipline's toolbox. So I had to find a new toolbox. So as a medical anthropologist, I could see you asking questions of systems, in which case you want to adopt some systems methods, or you just want to, you know, explore context, et cetera, that I feel like medical anthropologists are actually already really good at doing using existing methods. So I hope that kind of answers, yeah, just early thoughts on how.
No, that's great.
Yeah.
Well, unfortunately, we're going to have to close the questions and discussion. But I will say once again, Tara, thank you so much for a really, really illuminating and pedagogically sound and inspiring presentation. You've really given us just a whole new practical approach to thinking about how we might use systems thinking in some of the modeling applications that you might have. So thank you so much.
My pleasure.
With that, we will close today's seminar and look forward to seeing everybody next week. Same time, same place. And that's what, yeah, that's it. Thank you.